Hey, it's Dr. Joseph with Vale Summit Orthopedics. Today I'm going to briefly discuss golfer's elbow. It's more of a summertime thing, of course, but we see it very commonly. It's similar to tennis elbow, so I'm going to distinguish between the two today. It's an elbow epicondylitis. So what does that big word mean? At the very end of your humerus, at the very end of your arm bone, there's two big bumps. One's on the inside, meaning on the inside of my elbow here, the medial side, and then one bump is on the outside or the lateral side. So the mnemonics go that on the lateral side, the outside portion, we call that tennis elbow, and on the inside we call it golfer's elbow. But it's not specific. We'll see golfer's elbow in tennis players and vice versa. I got it myself on the lateral side, on the outside, from doing a lot of oaring, and I see that a lot with patients that do a lot of rowing on the rivers. That's a common. It's usually a gripping type scenario, and if you grip this way, then it's more common on the lateral side, and if you grip this way, then it's more common on the inside. And so, but they're very similar entities, and what they are is that fancy word epicondylitis. So these bumps are called epicondyles, and the reason the bumps are there is the tendons that run our wrist and the tendons that run our forearm and run some of our fingers. Those tendons have to originate or start from the one spot, and they start from these bumps. So they're the attachment point of the tendons that reach out and turn into muscles that control our fingers, our wrist, our hand, everything downstream. So if there's an overuse deal, which typically these are, is an overuse thing, then it can become inflamed. And it's kind of like there's little small micro tears of the tissue that are there. These two little areas, the golfer's elbow and the tennis elbow, they don't have good blood supply, and that's the problem with them, and that's why they're so common. So you get these micro tears that are quite small. It's not usually one injury. It builds up, it sneaks in, and then the body has trouble healing it and has trouble fixing these because it doesn't have a good blood supply. It's called a watershed area, meaning it doesn't have a dedicated blood supply. It has to get it from neighboring areas. So once the cycle breaks, once the cycle starts with the micro tears, it becomes inflamed, it becomes irritated, it's hard for it to break. So then we commonly see patients all months of the year that come in with a annoying tenderness in that area, and it can be pretty debilitating. The first line of treatment is stretching, ice, anti-inflammatories, time, avoiding the activities that bug it, with or without PT. If that doesn't work for 6 weeks, which is where we kind of see them, then we consider doing an injection. And that's what ended up having to happen with my own elbows. But the injections are very rewarding, meaning that they tend to be very successful. The book says 90% success rate for an injection. And some people say, well, isn't that just temporary for the tears? It breaks a cycle of inflammation, which allows, without getting into the technical terms, it allows the body to actually heal this tissue and let it not come back. The 10% in that 90-10 scenario is the 10% that keeps coming back. And the book basically says if we've done 3 injections in a year and all this other treatment in a whole year, then we get an MRI and see if there's bad chronically torn tissue. And that 10% that recurs and had a year of treatment, and in my book has had 3 injections, then those are the ones that we offer an operation for. And that operation involves repairing the tendon and sewing it back to the bone. But it's much more common to have the injection work 90%. So if you've got elbow pain for an overuse type scenario, then it's most commonly either golfer's elbow on the inside, tennis elbow on the outside, and you can come in and say, hey, I've got medial epicondylitis. And I'll be like, yeah, okay, you watched the video, or you figured it out yourself with Dr. Google. And so we can treat that and make that go away. So come see me, Dr. Joseph, Vale Summit Orthopedics.